Welcome back, friends. October is RSV Awareness Month, and here with more information on this contagious respiratory virus are Dr. Leonard Friedland and renowned actress and executive producer Jennifer Beals. Good morning. Thank you so much for joining us this morning.
Thank you for having us.
Oh, so
Good morning.
Dr. Friedland, can you explain to our viewers what RSV is?
Oh, absolutely. And thank you for the opportunity to come speak with you today. So RSV is the respiratory syncytial virus. It's a contagious and potentially serious respiratory virus. It can affect our lungs and our breathing passageways. Now, most people think about RSV as a disease and infection of infants or young children. But the reality is that it can affect people of any age, especially those who are older. And this increased risk for severe outcomes from RSV is associated with being an older adult. Now, for most people, RSV is just a very mild illness, and you'll hear about this from Jennifer when she'll talk to you about her particular illness. But it typically starts as a runny nose, a type of cold, maybe some coughing, sneezing, low-grade fever. However, in certain people, such as older adults, including those with underlying chronic medical conditions like heart and lung disease, RSV can then develop into pneumonia, can result in hospitalization, and sadly can even result in death. Now, the RSV season typically starts and peaks in the fall and then peaks into the winter. And for people 60 years of age and older, and you'll hear about Jennifer, who works into this demographic, this disease can be quite a disease that is worthwhile discussing.
You know, I'm so glad I'm learning about this. And Jennifer, can you tell us about your experience with RSV and how your life is impacted by it?
Well, first of all, thank you so much for having us. And I wanted to thank GSK for inviting me to join their RSV awareness campaign by sharing my experience. Just by way of context regarding my experience with RSV, first of all, I wanted to say that I have always prioritized my health. I've always been proactive about my health, and I consider myself an active person. You know, I love being outdoors. I kind of need to be outdoors. It's a real source of joy for me. And I love exercising outdoors. I hike, I love open water swimming, I love kayaking and playing pickleball. And I also have an active work life. You know, when I'm not on set, I'm usually in daily meetings, developing new projects. So when this first happened, the symptoms were really mild. You know, it was just like a little cold. I had a little bit of congestion and a low-grade fever for a day. Out of precaution, I took a COVID-19 test, and that came back negative. And so I just, you know, treated it like a small cold. And then my symptoms started to get worse. You know, I was having trouble sleeping because the congestion got so bad, and I had developed this persistent cough. And pretty soon, all those things that I love to do, like hiking and swimming and kayaking, became that much more difficult because my breathing was compromised. It also impacted my ability to communicate at work. You know, I was on calls and I would have to mute them all the time because of this cough. This is all to say that everything became that much harder to accomplish. And I couldn't figure out for the life of me what was going on. So finally, I went to go see my doctor, who diagnosed me with RSV. And I was completely shocked because I had always thought RSV was an anomaly among adults. I thought it really only affected young children and infants. And then I was in shock again when she told me that there was no specific treatment for RSV and that the best thing that I could do would be to rest, which is, you know, challenging for me. So I did. And the symptoms persisted for about 2 months. And then I was fine. I'm fine now, but it was a real wake-up call as to the potential severity of respiratory illnesses like RSV.
Right, especially when you are an active, healthy person as you are, or you thought you were. Dr. Friedland, what can people 60 years and older do to help protect themselves against RSV?
Yeah, thank you. Jennifer's story is very typical of what this illness can be and what this disease is like in adults over the age of 60. In particular, those who have underlying chronic medical conditions, and all people over the age of 75 who are at risk for severe RSV, which could even include hospitalization and unfortunately even death. There's about 177,000 adults every year in the US who are actually hospitalized due to RSV, and about 14,000 will die. So I'm really glad that we're talking about this now because right now is typically the start of the RSV season. All across the United States typically starts in the fall and peaks into the winter. And so if you are between the ages of 60 and 74, with certain risk factors like underlying chronic heart and lung disease, a weakened immune system, or, for example, live in a nursing home or other types of close congregate settings, or if you're 75 and older, just in general, you should be speaking with your doctor or your pharmacist and asking them about RSV and about vaccination. And to learn more, if you want to learn more about what this disease is and the options that are available for vaccination, a website that we've created is sidelinersv.com, sidelinersv.com, which is a great resource, again, to learn about RSV and about vaccination.
Dr. Friedland and Jennifer Beals, thank you so much. Jennifer, thank you for telling your story. You're going to help a lot of people who are hearing about what you went through today. So we appreciate you so much and your time. And again, I hope people get a lot of information and education about this. Thank you so much for your time this morning. Great to meet both of you.
Thank you, Jeremy.
Thank you.
All right, don't go anywhere. Much more fun on Unscripted coming up after this.